A heart attack doesn't happen the moment someone clutches their chest. The real disaster begins silently, often years earlier, inside the arteries that feed the heart itself. Fatty deposits slowly build up, blood flow narrows, and one day a tiny rupture can trigger a deadly chain reaction. Within minutes, heart muscle starts dying from lack of oxygen. But what exactly is happening inside the chest during those critical moments? And why can every second mean the difference between life and death? Every beat of your heart depends on a constant supply of oxygen-rich blood. Ironically, the organ responsible for pumping blood throughout your body cannot survive without its own dedicated network of blood vessels called the coronary arteries. These arteries wrap around the surface of the heart like life support lines, delivering oxygen and nutrients to billions of hard-working muscle cells. A heart attack, medically known as a myocardial infarction, occurs when blood flow through one of these coronary arteries becomes severely blocked or completely cut off. When that happens, part of the heart muscle is suddenly deprived of oxygen. Unlike many tissues in the body, heart muscle has very little ability to rest or regenerate. It must keep working every second of every day. As oxygen levels fall, cells begin to malfunction. Electrical activity becomes unstable, and irreversible damage can start within minutes. Understanding what happens during a heart attack reveals why rapid treatment is so critical and why recognizing the warning signs can save lives. Time. Under normal circumstances, the heart functions as an incredibly efficient biological pump. With every heartbeat, it contracts rhythmically to push blood through a vast network of vessels reaching every organ and tissue. To power this non-stop activity, the heart requires a continuous supply of oxygen and nutrients. This supply comes through the coronary arteries, which branch into smaller vessels that penetrate deep into the heart muscle. Oxygen carried by red blood cells is delivered to heart cells, where it is used to generate energy through cellular respiration. That energy fuels contraction, electrical signaling, and all the processes needed to maintain circulation. Healthy coronary arteries have smooth inner walls that allow blood to flow freely and efficiently. They can also widen when the heart demands more oxygen during exercise, stress, or physical activity. This flexible and reliable delivery system ensures that the heart receives exactly what it needs when it needs it. As long as blood flow remains uninterrupted, heart muscle cells stay healthy, energized, and capable of maintaining the vital rhythm that keeps the body alive. Do understand a heart attack. It helps to know the structures involved. The heart is a muscular organ divided into 4 chambers, but the key players in a heart attack are the coronary arteries. The 2 main coronary arteries emerge from the aorta, the body's largest artery. These vessels quickly branch into smaller arteries that spread across the heart's surface and dive into the muscle. Their job is to nourish the myocardium, the thick layer of muscle responsible for pumping blood. The inner lining of each artery, called the endothelium, is normally smooth and protective. Over time, however, cholesterol, fats, inflammatory cells, and other substances can accumulate beneath this lining, forming plaques. These plaques may grow gradually for years without causing symptoms. Some become hardened and stable, while others remain fragile and prone to rupture. The artery itself becomes a battlefield between blood flow and obstruction. The location and severity of any blockage determine which portion of the heart muscle becomes threatened during a heart attack and how extensive the resulting damage may be. Not as many they need. The heart's survival depends on uninterrupted circulation through the coronary arteries. Blood enters these vessels carrying oxygen, glucose, and other nutrients required for cellular energy production. Heart muscle cells use oxygen to generate large amounts of ATP, the molecule that powers contraction. As blood flows through coronary arteries, oxygen diffuses into surrounding tissues, while waste products are carried away. During physical activity, the heart beats faster and stronger, increasing its oxygen demand. Healthy coronary arteries respond by widening to deliver more blood. This balance between supply and demand is carefully regulated every second. Electrical signals generated within specialized cells coordinate each heartbeat, ensuring that contractions occur in an organized sequence. Adequate oxygen is essential not only for muscle contraction, but also for maintaining stable electrical activity. When blood flow is normal, the heart functions with remarkable precision and efficiency. Every beat depends on millions of cells receiving oxygen at exactly the right time. Disrupt that blood supply, even briefly, and the entire system begins to unravel rapidly. A heart attack begins when blood flow through a coronary artery becomes critically reduced or completely blocked. In most cases, the culprit is not a gradually narrowing artery alone, but the sudden rupture of an unstable plaque. When the plaque's protective surface cracks open, the body interprets it as an injury. Platelets rush to the site to form a clot, just as they would to stop bleeding from a cut. Unfortunately, inside a coronary artery, this protective response can become deadly. The growing clot may partially or completely obstruct blood flow. Downstream heart muscle cells are suddenly cut off from oxygen and nutrients. Within seconds, their energy production starts to decline. As oxygen deprivation worsens, affected cells struggle to maintain normal function. The longer the blockage persists, the larger the area of threatened heart muscle becomes. This is why heart attacks are medical emergencies. The issue is not simply chest pain. It is an active process of tissue starvation that can rapidly progress toward permanent muscle damage and life-threatening complications. The most common cause of a heart attack is coronary artery disease, a condition driven by atherosclerosis. Over many years, cholesterol, fats, inflammatory cells, and cellular debris accumulate within artery walls, forming plaques. Several factors accelerate this process, including smoking, high blood pressure, diabetes, obesity, lack of exercise, chronic stress, and elevated cholesterol levels. Family history and aging can also increase risk. As plaques enlarge, they may narrow the artery and restrict blood flow. However, many heart attacks occur in arteries that were not severely narrowed beforehand. The greatest danger often comes from unstable plaques with thin outer coverings. These plaques are more likely to rupture unexpectedly. Once rupture occurs, clot formation can rapidly block the vessel. Less common causes include coronary artery spasms, spontaneous artery tears, severe blood clotting disorders, or drug-related vessel constriction. Regardless of the trigger, the final result is the same. Oxygen-rich blood can no longer reach a portion of the heart muscle, setting the stage for a medical emergency. The moment blood flow stops, a devastating chain reaction begins. Within seconds, oxygen levels inside affected heart muscle cells drop sharply. Without oxygen, energy production shifts to inefficient emergency pathways that cannot meet the heart's demands. ATP stores become depleted, cellular pumps start failing, and harmful waste products accumulate. As cells struggle to survive, the affected area becomes weaker and less able to contract. Electrical instability develops, increasing the risk of dangerous arrhythmias. After about 20 to 30 minutes of severe oxygen deprivation, irreversible cell death can begin. As more cells die, the heart's pumping ability declines. The damaged tissue triggers inflammation as the body attempts to clean up dead cells and begin repair. Unfortunately, scar tissue eventually replaces lost muscle, reducing long-term heart function. If a large enough area is affected, the heart may fail to maintain adequate circulation. What started as a tiny plaque rupture can quickly escalate into a life-threatening cascade that threatens every organ in the body. The symptoms of a heart attack result directly from the ongoing damage inside the heart. The most recognized symptom is chest pain or pressure, often described as squeezing, heaviness, tightness, or a crushing sensation. This discomfort may spread to the arm, shoulder, neck, jaw, back, or upper abdomen. Many people also experience shortness of breath because the heart struggles to pump efficiently. Sweating, nausea, dizziness, weakness, and feelings of impending doom are common as the body reacts to stress and reduced circulation. Some individuals, especially women, older adults, and people with diabetes, may experience less typical symptoms such as unusual fatigue, indigestion-like discomfort, or mild breathlessness. Symptoms can appear suddenly or develop gradually over several hours. Importantly, not every heart attack looks dramatic. Even subtle symptoms can indicate active heart muscle damage. Recognizing these warning signs early and seeking immediate medical attention can dramatically improve survival and reduce permanent injury. The primary goal during a heart attack is restoring blood flow as quickly as possible. Doctors often describe this principle with the phrase, "Time is muscle," because every minute of delay allows more heart tissue to die. Emergency treatments focus on reopening the blocked artery and limiting damage. Medications such as aspirin help prevent further clot growth, while additional drugs may reduce workload on the heart or dissolve clots in certain situations. The most effective treatment is often emergency angioplasty, a procedure in which a catheter is guided into the blocked artery and a balloon is used to reopen the vessel. A stent is usually placed to keep the artery open. Once blood flow returns, surviving heart cells can recover, although tissue that has already died cannot be restored. Long-term treatment includes lifestyle changes, medications, cardiac rehabilitation, and management of risk factors. Preventing future blockages is just as important as treating the immediate emergency, because heart attacks often signal underlying coronary artery disease. One of the most remarkable facts about heart attacks is that the body can sometimes create its own natural bypass routes. When coronary arteries gradually narrow over many years, tiny blood vessels known as collateral vessels may enlarge and form alternative pathways around blocked regions. These vessels can partially compensate for reduced blood flow and may help protect heart muscle during an artery blockage. While they cannot completely prevent a heart attack in every case, they demonstrate the extraordinary adaptability of the cardiovascular system. Another fascinating detail is that heart muscle cells begin dying within minutes of oxygen loss. Yet rapid treatment can rescue large areas of threatened tissue before permanent damage occurs. Modern medical technology allows doctors to reopen blocked arteries and restore circulation with incredible precision. This combination of biological resilience and medical intervention means that many people who once would not have survived a heart attack can now recover and return to active lives. A heart attack is far more than chest pain. It is the result of a sudden interruption in the heart's own blood supply, usually triggered by plaque rupture and clot formation within a coronary artery. As oxygen delivery stops, heart muscle cells enter a desperate struggle for survival. Energy production fails, electrical activity becomes unstable, and tissue damage spreads with every passing minute. The symptoms we feel on the outside reflect a dramatic battle occurring deep within the heart. Fortunately, modern treatments can restore blood flow and save threatened muscle when action is taken quickly. Understanding what actually happens during a heart attack highlights the importance of prevention, recognizing warning signs, and seeking immediate medical care. In the race between oxygen loss and treatment, every second truly matters.